So this is a case study of an augmentation rhinoplasty. And what we mean by that is we want to actually augment some of the nasal features rather than reduce them. So in this case study, we have a patient who wished to augment the height of her bridge and also make her tip look more defined. So the underlying cartilages appear like this. And what we want to do is we want to actually project the tip forward by using her own cartilage. And where do we get the cartilage from? Well, we actually take it from this cartilage inside the nose called the nasal septum. So we've schematically removed that cartilage so that I can show you where I take the cartilages from. So what I do is I shape cartilages, I shape grafts that I'm going to use to augment her tip from her septal cartilage. And this is what we call a shield graft. This is called a columellar strut, and these are cap grafts. And there's actually plenty of cartilage in the nasal septum to make all of these grafts for a person. So once we harvest the cartilage and make the grafts, we can use it throughout the surgery. So cartilage grafts are harvested in most cases from the nasal septum of that individual. We can sometimes take that cartilage from the ear as well if there's not enough cartilage in the nasal septum. Essentially, these cartilages are hand carved and they're shaped to the requirements of the individual patient. In this particular case, I needed 3 types of grafts. I needed 2 very small grafts that we call cap grafts. I needed something called a strut or a columellar strut and something called a shield graft. And I'll show you where I placed those to augment her tip. So once the cartilages are harvested, then we can use them throughout the surgery. Now this is obviously an enlarged view. This is actually real life, assuming that your screen is the same size as mine. This cartilage is about 9 to 10 millimeters wide. So that's the width at the very top. So this would be probably 4 millimeters wide, and same thing for these. On her base view, what we really want to do is we want to augment the position of her tip. In fact, we want to push it forward so that it comes away from the face longer. So the first thing that we do is we use the first cartilage called the columellar strut. And that actually sits between the 2 tip cartilages to support them and project them forward. The second thing we do is we put more cartilage on top of that, again, to push the skin in a forward direction. And the last thing is we put something called a shield graft. And that shield graft camouflages all of those other grafts and gives a nice smooth contour to the tip of her nose. So this is the before and after view of this patient. So you can't see it because I've used the shield graft, but there is a strut of cartilage in here, and there's also 2 cap grafts at the top which are pushing the skin forward, and that's why her tip is projecting away from her face more. So essentially it's projecting further forward because it's being pushed by the cartilage grafts that I've placed. Now the other thing that we did for her is we augmented her bridge. And so you can see over here there's a sort of a gray bit of tissue here. This is actually Gore-Tex. And the Gore-Tex is inserted and lays right on top of the nasal bridge bones and cartilages. And that augments this part of the bridge. The reason we use Gore-Tex here is because you probably need several millimeters of augmentation of the bridge, and usually the septal cartilage is just not that thick. So I think in most cases, to get a substantial augmentation, you usually have to use a synthetic material. I like to use Gore-Tex because it's soft and I can carve it in a very custom way. It also has a very, very low rate of complication, so I think it's a good material to use for this purpose. So in addition to the Gore-Tex graft that you can see that I've applied to the bridge, I'm also showing the cap and shield graft that I applied before on side view. And you can kind of get the sense for how these cartilages project her existing cartilages further forward and therefore project her tip further forward and give it more definition. So this is before and this is after with the tip cartilages in place and the Gore-Tex graft on the bridge. And then I'll just show you her actual photos so you can see that her tip has been projected further forward, and I've done a very subtle augmentation of her nasal bridge. You'll see on her base view that in addition to projecting the tip in a forward direction, I've also narrowed her nostrils. So what I've done is I've made some small incisions just at the base or the nasal sill, so just the floor of the nostril, right around the corner. I've removed some of the skin and then tucked it inwards. So you notice that this On this view now, her nostrils are much narrower. It's also changed the contour of the sidewalls a little bit, and so these are a little straighter now than they were before. So they were slightly flared, and now they're a little straighter. So overall, again, this is a before and after of augmentation of the nasal bridge, the nasal tip, and reduction of the alar base. And these are her 3/4 views.